I'm a patient partner and advisor on various health initiatives, but my passion is decoding end of life conversations. My aha moment came on a tweet chat with healthcare professionals dedicated to a meaningful and good death, and I realized I had no idea as a regular person what the heck they were talking about. So I began to blog about it, created a website called Best Endings, and wrote a book called Death Kills, all about health literacy.
I had my aha moment in the Bahamas. I was in an emergency room waiting for my daughter and desperately searching for something to read. I found some pamphlets, including one about pregnancy testing. Now, I had run a women's health center for a number of years, so I was curious what theirs was going to say. Ours said, to get a sample, you urinate in a clean glass container. Theirs said, to get a sample, you pee in the cup. That was my moment. My aha moment. Then you pee in the cup.
Hi, my name is Marguerite DeBello, professor of nursing at Eastern Michigan University, and this is my aha moment. Last year, my mother spent a month in the ICU related to an undiagnosable infection in her neck, which caused her to be on a ventilator in the ICU for over a month. During that time, there were a lot of things that were foreign to me. My specialty is in ICU. So I was able to ask lots of questions, get the information I needed to relieve my anxiety and to understand a little bit better about what was going on with my mom. However, as I sat there and I looked at the other patients and their families, I wondered, how do they navigate this system? How do they understand what's going on if this is confusing and scary to me? So my aha moment was that during my experience with my mother, I learned and understood how other people felt that do not have the health literacy to understand what is going on in that environment and the need to further educate them to help them with their anxiety and understanding the situation that they're in health-wise.
My aha moment, the moment that made me realize that I really wanted to focus on health literacy within my professional public health journey, was probably when I started at Cura Strategies to support a health literacy initiative in Rockford, Illinois. And I'm still working on that initiative. What I've been blessed to learn through this process was that communities don't need saviors. They need tools. Accessible and easy to understand tools to empower them to make the best decisions for themselves. And I'm honored to be in the business of empowerment.
6 months before the onset of the pandemic, my 4-year-old son was diagnosed with autism. And for me, call it an aha moment in retrospect, but I was a lost puppy when it came to navigating this new world that I found myself in, especially when the world shut down. If finding and accessing resources locally and supporting him was this hard for me as a health communications professional, I imagine how hard it must be for those who don't share the same background, who don't know what terms to Google, who don't know what trustworthy, incredible organizations are when they show up in your search results feed, or who to even go to ask questions. When you actually live this journey, you learn a lot along the way, and you learn to lean on other parents who might have a child who's slightly older than yours, but lives in your area. They are wonderful resources to ask questions, to get advice, to vent. No one can walk this journey alone, and peer-to-peer navigation of our healthcare and our education system, because they're very different, is an integral element of health literacy.
My aha moment was when I attended my first health literacy training course alongside other health and care professionals. It was simply this. The trainer asked us to do some reading, writing and arithmetic activities, all of which put us slightly out of our comfort zone and weren't related to health. The trainer then said, bottle that feeling. And now imagine feeling like that when you are being expected to understand and act on health information, which is most likely to be really important to you. So with this in mind, why wouldn't you make sure that the information you share is as clear and as understandable as possible?